So I'm going to stop sharing for a minute just so I can see everybody. Hello, welcome everyone. If you're able to turn on your camera, unless you're out for a walk, which is what I did yesterday. Hey, Jennifer, great talk yesterday.
Oh, thanks, Carol. Thanks so much. It was,
Yeah,
it was
fantastic.
great.
Welcome everybody to the Special Interest Group of Nursing here at the HARC conference. I hope everybody's been enjoying the conference as much as they're able to. I know if people are like me, I'm like multitasking around the conference, which is sort of a shame, but that's the way it is. If you're able to, please turn on your camera. If you're not, if you're eating lunch, I totally understand. If you're out for a walk, if you're on the elliptical, these are all the things I was doing yesterday when I was in, well, the webinars are a little different. Nobody can see you anyway. So welcome. Should we try and do introductions? There's a lot more of us now. So I'll just start. My name is Carol Howe. I'm an associate professor and the Parker Endowed Professor at Texas Christian University in Philadelphia. I do health literacy research here in the North Texas area. And I'm also, as a clinician, a diabetes expert. Let's just do quick. I don't want to spend too much time, but go ahead, Tracy. You want to introduce yourself?
Good afternoon, everybody. Thank you for joining us. My name is Tracy Alberti, and I am an associate professor and the associate dean of nursing at Merrimack College School of Nursing and Health Sciences, which is in the northeast corner of Massachusetts, just about 20 miles north of Boston. I do health literacy research. I also do nursing workforce development work in the Merrimack Valley area. So welcome everybody.
Jennifer, why don't you go and then tag somebody else, okay?
Okay, deal. Jennifer, I'm from Toronto, Canada, and I teach at U of T in nursing. Okay, Inga.
Hi, everyone. I'm Inga Zydvitskas from the Ohio State University in Columbus, Ohio at the College of Nursing. I work at the Fold Institute for EBP, and primarily our department, we're trying to promote the use of health evidence among consumers. And I am new to the field of nursing research within health literacy. Thanks.
Got it. I just did all your implementation science modules from the Fold Institute, and we got a grant from you to do it. So I love your institute. Deneen? Or Jill? Peg? Anybody would like to introduce themselves?
Hi, I'm Peg Hickey. I'm from New York. I'm currently a faculty at a pre-licensure nursing program in the City University of New York.
Mm-hmm.
And I am also working on my PhD in halfway through the coursework, but I am focusing on health literacy and nursing education.
That's awesome.
Hi, good morning, Dr. Shyla Williams, San Diego State University, Imperial Valley School of Nursing, as well as the Imperial Valley campus. Teach in the Masters in Nursing Leadership program and oversee it as a concentration chair. And my work is in health literacy in rural border regions, particularly in largely diverse and socially and disadvantaged populations.
Thank you. Anybody else would like to introduce themselves?
Sure, I'm Jane Sims, and I'm the manager of patient education at Intermountain Healthcare. And in my role, I am involved in content development, but also in teaching or creating tools for our nursing staff and students to learn about Teach Back and health literacy and implement that in their daily practice.
Yeah, your talk was fantastic yesterday. I'm going to look up all your work.
Thank you.
Thank you.
Thank you.
Hi, would anybody else like to introduce themselves? Hi,
Sure,
Carol.
hi. Oh. Hi. Hi, Jane. Good to start with you, Jane. Hi, I'm Carolyn Catilli. I am adjunct faculty for American International College out of Springfield, Mass. I teach in the master's program, research and health policy, and undergraduate evidence-based practice. And for Penn Medicine, I'm a patient education specialist.
I'm Suzanne Ogaitis-Jones, and I work for the state EMS office in Maryland, but I coordinate a grant to educate healthcare providers on child passenger safety and occupant protection.
Would anybody else like to introduce themselves?
Hi. Oh,
Go for it, Suzanne.
I think Jill wanted to say hello.
Hi, I'm Jill Hecker Fernandez. I am previously faculty at the University of Wisconsin-Eau Claire as a clinical assistant professor of nursing. I currently work with Phoenix Children's Hospital, actually Phoenix Children's now, as a consumer health nurse information specialist.
Interesting.
Hello, everyone. I'm Sophia Wong. I'm a patient education specialist at Ontario Health. So presenting Ontario, Canada.
Wonderful. Anybody else like to introduce themselves? Or we can move into conversation. Hi, Michael. All right.
Just
I'm
saying,
gonna-
I didn't mean to interrupt.
No, you're all good. I'm going to share my screen just to get our conversation started. And I think we're a large enough group. We're going to break out into 2 breakout rooms, but you are at the Nursing Special Interest Group, and we're hoping to talk about nursing research in health literacy and equity here today. Myself and Tracy Alberti were your moderators, but you really are the content experts. So we're hoping that we have a lot of discussion about that. So we're just here to facilitate. We do fundamentally believe as nurses and nurse researchers and people that are in positions like patient education specialists, we are completely positioned to investigate and identify effective strategies to meet the Healthy People 2030 health literacy goal, which is to eliminate health disparities, achieve health equity, and attain health literacy to improve the health and well-being of all. You can see nursing is really involved in research addressing all these issues as well as all these things together, connecting the dots. So during this next hour, we're hoping that we get to know each other more. We're going to go into breakout rooms to discuss some posed questions, and then we'll come back to the larger group and see what we've all come up with. So the objectives really are to really think about or discuss what current nursing research projects and programs that are going on amongst all of us in this special interest group. Is to identify and seek, both learning from each other, how we identify and seek research collaborators. And certainly, I think all of us would welcome anything bubbling up from conversation as well. Amongst all of us, as well as what are the opportunities for future health literacy research that addresses health equity. So these are going to be the questions that we're going to do. And Tracy, I think you'll be able to pull this up in your breakout too. What we're going to just discuss 3 major things, and we can go into that as we get into the breakout rooms. All right, so I'm going to share, and then I'm going to put us into, I guess we want to go. There's now 29 of us. I mean, I'd ideally go into 3 rooms. Well, we'll go into 2. Yeah?
Sure.
Sure. All right. Include co-host breakout rooms. Yes. So hopefully we'll end up in different rooms, Tracy. So the room should be opening up and you just accept it, please. Hi, all. All right. I'm going to share my screen again so we have the questions up. Are people with me? All right. If anybody would like to turn on their camera, if that's possible for you. And Mario, where did everybody go? How come I only have 4 people in a room?
I see room 1 has 12 people, room 2 has 12, and then unassigned.
Oh,
Yeah,
did
you
I
need-
not go? Did we not go into rooms?
You need to join a room, yeah.
Oh, I see.
Like,
Can you move us? So I need to go where Tracy is not, okay?
okay, she's in room 1, so
Move
I
me
need
to
to assign you to
2. I
room
don't know
2.
why. Okay, I can go to 2. I get it. Okay. Join.
There you go.
Oh my goodness, we were talking. Sorry. Hello. So I don't know whether somebody from my group wants to try and summarize. I hadn't assigned that task to anyone, or is that my task? My task? Okay. Okay, I'm going to summarize and then, but please, everybody in my group, because everybody had a lot of things to say. So we started off really trying to answer the questions we posed, but then we just had our conversation that just sits adjacent to the questions, I would say. But really talked about, because we didn't really answer it in terms of what research, but what we're doing and what are the issues and all that. So we first started off talking about, you know, to address health literacy and health equity, really have to thinking about how health information is provided to different populations, how it supports different populations, especially around particular health issues, like, for example, diabetes or heart failure. Talked about how, you know, sometimes health education is really moving into the public health arena, like providing information to people where people work, play, and pray. But then we really started talking about, well, using TeachBack and how to integrate TeachBack and what kind of research is needed in there, knowing that the randomized control trials have been showing that TeachBack is effective, but how do we actually implement it, scale it up, and convince people that it's helpful? Because we talked about, or I talked about that I'm not able to always convince nurses that it's relevant and useful. So we then talked about ways that we can show people the level of misunderstanding that can come in the healthcare when people enter the healthcare world. So one person brought up a physician's example of bringing origami in and giving people, medical students, all these origami papers and saying, okay, make something. And they just sit there. Then she gives them directions and they're still not sure. And then she verbally explains and gives them directions. And they kind of are like, why didn't you do that in the first place? So, but let's see. People talked about, you know, really setting up policy and somehow being able to show nurses the return on investment when they do TeachBack. And then we flip to what people do to incorporate TeachBack. So some people have onboarding, really some training right at the beginning when people come in, that it shows the organization's commitment to that. Carolyn from Penn really talked about she waits and it's voluntary when people have more experience. So they're not so worried about sterile technique now, but able to take in this other information. And she has a whole day training session plus, so it's training information in the morning and then standardized actors in the afternoon to really practice role play. That's fantastic. But then we talked about, like, people are worried about time to do TeachBack. So how do we show that, again, the return on investment? So that's where we were. We didn't come up with any research questions, so to speak, but we just kind of threw out a lot of issues. Did I capture people that were in my group? Did I capture it? Okay. All right.
Yep.
Other group, please.
Would anyone from our group like to summarize a couple of our points? Anyone feel comfortable with that?
Go for it, Tracy.
All right. So we started just kind of asking around our group what was happening right now, current research efforts or project efforts with an emphasis on equity and looking at health literacy as essentially a social determinant of health. And so there's a QI project going on right now in St. Jude, looking at readability of information, translation, and looking for interpretation and assessment of that material, effectiveness around that. Jane is working actually on a Teach Back initiative right now to it's going to be an intervention study that's going to be looking at outcomes around effective Teach Back. And there's going to be, I want to say, I'm going to paraphrase Jane, but community healthcare workers are going to be educating nurses, physicians, and actually patient front-facing staff on that technique. And they're still kind of determining what those outcomes are going to be. We've talked about looking and evaluating at EMR records and how are we going to be able to effectively use those when we think about patient information and patient teaching stuff. How or what the nursing intervention, where nursing and nursing research could be the most effective. And it's Jane had offered this wisdom. It's all kind of around that initial intake, but spoke very eloquently around the nurse's trusting relationship that's established and how any kind of limitations in health literacy or any other social determinants of health or equity struggles, those would tend to be coming out more readily if there was an established trusting relationship as opposed to just a screening tool or questions being asked. And so strategies and challenges around that. The identification when we think about future nursing research, how nursing is really the cornerstone for care. We talked about also challenges, and if we're going to be screening for health literacy, are we equipped to address it? And if we're going to be screening and trying to quantify health literacy levels for patients, are we equipped, and what are we going to do in terms of education? Are we equipped to address people at these different levels versus implementing effective universal precautions and teaching and utilizing those tools that we know? And we spoke a little bit about some of the other interventions that may truly help somebody that's challenged, not only in understanding health information, but particularly navigating our very complex healthcare system. So we spoke a little bit about patient navigators, and Inya had offered up that it really is not reimbursable. And so then we started to say, well, maybe that's going to be what nursing research needs to do, is to kind of show some of these additional interventions that truly support patients that may be suffering limitations. And so, is there some nursing research that could be done to then essentially show some ROI on that model, and then be able to help address policy and move policy for reimbursement? I think that that's some of what we said. So please, anybody else, please feel free to add the gaps. One other thing was, is there a nursing research serve, like a listserv that we could tap into each other for potential collaborators and ideas?
No, but that's an interesting idea. Could it just be a simple Google Doc for now?
Yeah.
No, I'm like sort of I'm trying to figure out what data we could collect from nurses that would convince them that Teach Back is useful. Anyway, that's the bug that got in my bonnet when we were talking, because they don't really care about the randomized controlled trials that show that it decreases hospitalizations. But if we could, and all that stuff, I think they'd really care if they show, wow, our teaching, like one nurse said, I'm finding that there's misunderstanding half the time. That convinces them differently. Carolyn, your thoughts?
Yeah, I think it's more so, not that they're not convinced by the studies. I think it's habit. I think it's time. I think it's peer pressure. If there's no one else. So we observed 17 nurses doing after visit summary. We have EPIC, so we have what we call the ABS. And when we observed it, the student who was working on this project came back to me and said, well, 4 out of the 17 did teach back. I'm thinking, okay, not great, but at least 4 did. She goes, let me tell you the bad news. I said, go ahead. She goes, it was all instituted by the patient. The patient did the teach back, not the staff. So I just think it boils down to habit. They're just not, and peer pressure. If nobody else is doing it, why do I do it? It takes more time. And I just think making that shift, that cultural shift, and you know, it's habits. Habits really are hard to die. They're
Really hard. No, I mean, I even got the patient ed materials to hang in the room. Like, it's fascinating to me because I said, oh, well, you hand them the printout from the AV. You hand them the printout after you've done the teach, but why couldn't you have it at the same time? And they go, well, the data surgery isn't on it yet, so we can't really, you know, so there's all these logistics. So then literally they wouldn't go out of order because that order works for the speed of the clinic, which I understand. So instead they're printed, we laminated and they're hanging in the room, but to get people to use them, they go, well, that's going to slow down my spiel. Like, I have a whole thing that I do. But you're right, its habit is hard to break. That's why some people talk about de-implementing habits in order to input in.
So Carol, you bring about something, and this is what we try to break with them when they work with the standardized patient. I have a whole thing I'm going to say. Patient ed is push out. At Penn Medicine, our group actually developed a graphic. I don't know, those of you who've got my emails, Jane, I know you've seen it. It's called Reach to Teach, where you're reaching out to someone to teach. And it stands for relate to the patient and family. You come up with a plan. Educate simply. E is for educate simply. A is for ask and answer questions, have a conversation. Patient ed should be a conversation, not a push out. C is for check for understanding.
Patient education is not a push out.
Yeah, and that's, see, that's what everybody thinks. I have so much time, I have to tell them all this stuff. It's all about me doing this. And so when they take the class, we flip it and say, it's all about the patient. Yeah, nice you're here. Yeah, we're working on a skill set, but really it's all about the patient. What does the patient need? Where are they coming from? So it's flipping that culture, because they're all like into pushing out. So that's why we came up with Reach to Teach, so that they'll think, relate to the patient, educate simply, ask and answer questions, check for understanding. And the H is all this helps promote health literacy. So, you know, that's what I drone in every single day of my job.
So I know you're really involved with HCEA, but in some ways, like a lot of us have collaborations, whether it's with nursing students or at hospital institutions or health systems. Like, have you packaged what you're doing with health? It's almost like we could take what you're doing and try and implement it other places and collect data. That's a whole nother idea.
Well, and you have the training program that you have developed. So, you know, what is it could we do? And I do think, you know, from the conversation,
we had the whole thing with patient actors too, but then COVID nixed it. So we've only been doing like interactive talking, but it's not the same. Yeah.
Yeah, I think the standardized patients are phenomenal. We did I did a pilot last year with my students, and the students loved it, but the standardized patients actually give feedback to the students. So they're hearing it from, you know, as if they're a patient. The problem with that is it costs money to run a standardized patient program. And I was the simulation lab, so it was just not sustainable. But it's a fabulous way to teach. And
yeah, I'm wondering, even if I bring into the clinic just for an hour a standardized patient and say, everybody do their teach.
Yeah.
And get, you know, so Inga, you had the thought, and then I think.
Yeah. I wanted to respond to your question, Carol, about trying to get the nurses to care about teach back. And I was thinking back about when it comes to evidence-based practice, when we're trying to make a practice change, there are always barriers, whatever the change might be. And one of the things that I've learned is that sometimes when it comes to trying to get the behavior change, I tailor the message depending on to whom I'm speaking. So for example, if you're talking to administrators, oftentimes they're the ones that care about ROI. In my experience, although we should all care about ROI, that the bedside nurses don't necessarily care about that. So I wouldn't lead with that, like maybe, the managers might care about that, but when you talk about the why, I found that the storytelling is really effective.
Yeah.
So giving examples, I'm sharing really compelling stories about like life-changing stories that give you goosebumps. And it's funny how when you share that, all of a sudden we've all had that when you're presenting, all of a sudden the room gets quiet and you can just sense that you've had that connection. So I think some of it might be tailoring the way that we're trying.
I share stories of my experiences with Teach Back, that when I started using it, even though I'd been following a family, let's say for 15 years, I learned this new skill called Teach Back. And then I learned that family never understood anything I ever did. In fact, they couldn't read numbers on a syringe. So when I was changing insulin doses, they didn't know how to do it. But, so 15 years in, because socially that mother never gave me any cue that she didn't understand. So Michael Pasciarlo is reminding us we only have 4 minutes. Is there anything we'd like to take from this energy? That we've had great conversation today. Fantastic.
Again, the biggest thing is how to connect, how to set up, how to get the support. When we spoke yesterday, as we just need to band together and pool our expertise. And, the next thing is the funding to be able to do it. Or even just our hospitals agreeing to give resources to be able to do it.
Yeah.
I also like the idea of the Google Doc if we want to somehow start that, have a shared listserv in some way.
Funding and multi-site studies. I know.
Yeah.
Okay. So I think IHA, Mario, are we able to get emails from everybody? Or Michael, do you know that everybody that attended this session?
We didn't have a plan for distributing emails. Is that what you're asking?
Yep. Okay, do we, and unfortunately I didn't grab all can you tell me who participated here? We don't have anybody's email to do this. Yikes.
Yeah. I can,
Can we type it into the chat? And
You-
then,
You can, but we're gonna beam out in 2 minutes, right?
oh,
the chat can be saved if you.
okay.
if
Can you
do this-
leave this open longer, or does it just stop at
Yeah,
1:30?
It will be open for another 5 minutes after.
Okay, everybody type in their email.
So on the chat screen on the right bottom corner, there's a little dot, and there's a thing option to save chat. If you can see that.
Yep.
And of course, we missed, some people already signed off, but I don't even know who they were that signed off. I can start a group. What's
I
that,
did-
Michael?
Oh, I'm not a nurse, but I have been funded by NINR. And so if people are interested in how to get money out of them, send me a note. I'm happy to try to promote health literacy activities through NINR.
Okay,
Wonderful. Thank you.
thank you. And how do I save this chat? Like I hit,
I clicked on it to save chat.
I did too, but then how do we get this into like a usable form other than when they close this, it's gone? Like who's gonna give us this saved chat is
I
what,
think
you
it's
can-
saved to your desktop.
Sorry.
did you do it, Tracy?
I think it saves automatically to your desktop.
Mario was going to say.
Yeah, so to save your chat, go ahead and click on chat. That'll open up the chat window on the right. Click
Yep.
the 3 dots, and then
Yep.
up at the top of that, it says save chat
I did. And where does it save it to?
on your desktop, somewhere on your computer.
You're saying it's somewhere on here? Did you get it, Tracy? I don't have it.
It says like a text file. I think it's .txt. I had to search for it one time.
Yeah, I'm looking.
Because I don't have it. So quick, hurry.
I saved mine and it says log.txt. No, and it didn't give me anything when I open it up.
All right, I'm gonna start taking screenshots. That's the other way to go.
It's saved and like it looks like chat. It's called Notepad. at least on my computer, it saves into something, so it doesn't go to Word. So then what you have to do to answer your question, you have to find it on Notepad and copy and paste it into a Word document. That's usually what I do. I don't know if that helps.
Okay, okay, I'm just gonna just add a paranoia.
I got it. Yeah.
I'm just screenshotting it. All right, so you're saying it went to my notepad? Nope.
And I can put it in Word. I just don't know to whom to send it. I can
You can send it to me, Carol,
okay. Mhm,
CAROL
mhm,
dot Howe, HOWE
mhm.
at TCU. Here, I'll put it here, just at tcu.edu.
Okay.